Adrian, I've been really looking forward to this conversation for a while. I was really happy that we found time to connect. There's so much I want to talk about in regards to your company, Alayacare, and the vision and the importance of its mission. I find particularly today, but maybe I'd like to start with the state of home care today. I'd be curious to understand your perspective on like the industry, where we're at exactly. Let's say today, middle of 2022. What is the state of home care?
Yeah, good question. So, home care is an industry where demand greatly outweighs supply. So, even prior to the pandemic, you ask the average person, would you rather receive care at home or in a hospital? Would you rather age in your home or in a long term care facility? And from a patient preference point of view, you will consistently have heard, keep me at home if you can. Okay. Flip side, from the health system perspective, it's by far the lowest care setting. So if we focus on senior care for a second, to sustain a frail elderly person at home, you're talking 70 to $100 a day. If you're in a long-term care facility, you're talking $400 or $500 a day. And the hospital is thousands of dollars a day. So we're not going to make it through this wave of the silver tsunami or the aging baby boomers with the current model of care. We have to move care into the home setting. And then boom, you have a global pandemic, very well reported on conditions in some of the long-term care facilities. And so, and hospitals, of course, also trying to get patients out or keep patients out from an infection control point of view. And so the demand for home care has gone through the roof. But unfortunately, the supply of care workers hasn't followed. In fact, has arguably gone the other way. And so it's a very supply constrained industry right now. And so we really see part of our mission as being, how do we make this profession more attractive to caregivers? And also, how do we help the sector maximize the leverage of the existing pool of care workers that exist in the space today?
Yeah, it's fascinating because Allied Care is like an enabling technology, right? So, like at the core level, you need to have people that are providing that care, and then Allied Care comes in and really provides that like augmented experience. How would you
Exactly.
rate the state of technology today, like outside of Allied Care, which you guys are obviously providing, a very cutting edge software to
Yep.
empower caregivers. Beyond that, like how do you rate the
Yeah.
state of tech?
Yeah. I mean, when we got into this business, right, and the company's 7.5 years old, I spent some time, of course, looking around the sector and seeing, okay, how well served is this industry with great software? And the answer at the time was not very. And if you fast forward 7.5 years, the competitors then are for the most part the competitors now, and nobody has successfully replatformed their tech. So there's a lot of on-premise software still out there. There's a lot of paper still floating around. And so, part of the reason that state of affairs exists is because to serve this market, you need a very broad footprint product, right? So we're the electronic health record, the workforce management system, the ERP, the billing system, payroll system. So a broad footprint product. And whereas from the outside looking in, you would think, okay, home care is a pretty narrow vertical. How many ways can there be to run a home care agency? Unfortunately, the answer is a lot. And it really matters who the payer is and what the local context is, what the regulations are. And so, whereas in general, it's a multi-billion-dollar addressable market, that's really composed of all these smaller TAMs. And it's hard in a small TAM to invest to build a great piece of software. So part of our success has been building a platform configurable enough to work across these various subverticals. And that's how we've been able to hit the escape velocity we have, and really, build a 700 person company, 300 person product and engineering team that can deliver really kind of 2022 grade enterprise software, but to a sector that traditionally has lagged quite a bit in terms of great technology solutions.
Yeah, you mentioned the pandemic, right? I think it clearly exposed the current state of like poor technology globally, but I think obviously we felt it much more in Canada, where it's like we need the private sector to step up, because it's like if you look at the public systems, they're just not there yet. And then going back to the insight that you had about, hey, like home care is definitely, there's a gap here.
Yeah.
Was that insight generated from your previous startup, Vortex Connect, where you were helping mobile workers? So was
Yeah.
there a tie in there? I'd like to unpack that, foundational insight moment, if you may.
Yeah, yeah, absolutely. So as you mentioned, my previous startup, Vortex Connect, was a horizontal mobile workforce management platform. So we had users, we had nurses, we had retail workers, we had oil rig workers, cops, you name it, using our app. Um, and at the time, it was kind of the earlier days of mobility, and the smartphone transforming how work was done out in the field. And so you could have a horizontal app that did scheduling and time and attendance and task management. And over time, the value shifted to more of the vertically oriented solutions. And we observed the early days of that. And so if we rewind to roughly 2010, TELUS, who was very keen to sell smartphones and data plans to these hundreds of thousands of care workers out in the field, needed an app to bring the productivity benefits. And so they reached out to us, said, hey, have you thought about the home healthcare sector? And we'd actually really just started servicing the market. We had a few clients. And then ultimately we got an acquisition offer from more of a retail supply chain oriented software company. We did that deal. And so I wasn't able to really scratch that itch, but I'd seen a little bit of the market, saw how poorly served it was with great software. And so there was that insight combined with, I'd been doing some angel investing, and I'd led an investment round in a point of care diagnostics company called Chipcare. And this opened my eyes to, man, all these things that were happening in the hospital today, tomorrow can happen at the bedside. And so, I imagined a future where home care would be much more technology enabled, and where a mix of care modalities would come together to make a home care experience 10x what it was today. In retrospect, I was a bit too far ahead of the curve with that insight, but I think correctly identified a space that needed some innovation, and very happy that decided to come into this sector.
Yeah, like I think a startup, success is all about timing, right? And that you guys just ahead of the curve, but also not that much, right? Because now, like you said, it's been in business 7 years. Past 2 years, we've been living with the pandemic. I know most people are fed up talking about the pandemic, but I think in your case, you guys provided a software and a service that was critical, right? That particularly when at a time where hospitals were overfloated, the cost of care at a hospital you mentioned is very, very high. So I'd be curious to hear you your perspective on the pandemic and the trajectory shift it had on your company.
Yeah. So in the early days of the pandemic, you can imagine, right? Clients were very scared to have care workers come into their home. Flip side, care workers, especially personal support workers, were saying, I can sit on my couch and, government's going to pay me roughly what you're going to pay me to go out there and risk my life and infection out in the community. So there was a very quick contraction. We track, cloud SaaS product, we can see the care volumes across all our platforms. And you see in mid-March 2022, boom, 20 to 30% volume drop like in a week. So it was scary times for our customers, for sure. But then, as they were able to acquire PPE, I don't know if you cast your mind back, that wasn't obvious, right? Can I get masks and gloves? They're all going to the hospital. Can I get them in home care? Not necessarily. And so, so quick dip, but then a month later, you started to see the recovery, and 3-4 months later, except for some disciplines like physio and others where you could really substitute virtual, you had the face-to-face care be back. And when we talk to our customers who run residential or long-term care and in-home care, the infection numbers were like day and night. They would have hundreds, if not thousands, of infections in their residential setting, and in home care, it'd be like a dozen. No deaths. So it was really, we were able to see how much safer a setting it was for care delivery, and so then the volume started to pick up again.
Yeah. Maybe a philosophical question, and maybe I'm getting ahead of my skis here, but like I think generally businesses like tend to do good in the world. Like you could do enterprise software or social media, and I think it's generally positive. But I think in your case, I imagine you must have a sense of responsibility more than just, hey, we're building a software company, and we're raising money, etc. Curious, like your thoughts on, like this has become more than just Adrian, more than just employees. It's like it's providing a level of care that's important to the world. So do you feel this burden of responsibility a little bit?
I mean, burden and privilege, I would say. So, our purpose as an organization is to enable the type of care we would want our loved ones to receive at home. And that's not a slogan. It is a material part of why people work at Alayacare and why we get up every morning and come and give our best effort to this business. So it matters. I do these fortnightly videos, just kind of company-wide communications, and I ask people, hey, do you want to share a story of how home care impacted your life? And almost everybody has some personal story. My grandmother, an aunt, when I had this surgery and was sent home. And so nobody's more than 1 degree separated from really feeling the impact of what we do. And so that's, you ask, is it a burden? I mean, yes, in the sense of, if a bug in our software can mean somebody's not getting care, right? Or if the app is down, there are vulnerable people at home not getting care. So we wear that as a burden, but we wear as a privilege the fact that we get to put our efforts towards, great care and better experiences for care workers and for the patients in their home.
Yeah, since you did bring it up, like my personal experiences, like peak of the pandemic, my mother-in-law passed away. We were taking care of her at home because it was either we take care of her at her place, or we have an hour of visitation rights in the hospital that were locked down, and this is May 2020. And having home care, workers coming and helping out was really helpful because we're able to sleep a bit at night and get a little bit of respite. So going back to what you're saying, having that layer of software and technology that empowers home caregivers to be able to provide a better level of support, to your point of the ones we care about the most, I think is a very, very inspiring mission.
Yeah. And so, if I cast myself back to those early pandemic days, it was actually really such an invigorating period because in the span of a couple weeks, we'd put out contact tracing tools within the app. We'd pivoted our virtual care tools such that, any visit, you could flip to a video conference. We really stress tested what of home care can be delivered virtually. And it was, I remember those days, kind of fondly in a way, because here was this global crisis. We were actually empowered to do something meaningful to help it. So very interesting.
Yeah, it's like that story of a soldier returning back from war. It's like you're in the battle, but when you look back on it, there's an inspirational element to it. I don't know if war is maybe a good example here, but being in a very kind of like high stress environment and that sense of urgency, have you been able to keep up that sense of urgency, or are you more thinking about more methodically, hey, we need to plan ahead, we need to think of future acquisitions, product roadmap, sales, etc. Curious as to how you keep that balance.
Yeah. To talk in real generalities, first year of the pandemic, yes, there was the adjusting to remote work and all that, but the relationships were formed and the adrenaline was there. And I would say, it's hard to very objectively measure productivity, But I would say that was a really, productive phase of Alayacare. Then you get into year two, and now, you know, a material part of the team joined Alayacare remotely, never met their colleagues face to face. So you didn't have the depth of relationships anymore. The mental health of, people at large, having been disconnected from their communities and, rolling down to your laptop in your pajamas, right? By year two of doing that, I would say that second year was harder, right? We tried to be very deliberate about the community building, and we've always been a really transparent organization. People appreciate that, and they feel connected to the mission. But that second year was more trying, more exhausting. I found I really had to, force myself to bring the energy every day. And then now that we can get back to some flavor of hybrid where we get together for some of the planning activities, I can get back out onto the road and visit customers again. Now I feel like we're in a new and better equilibrium. But yeah, that year two of the pandemic was, I look back less fondly on it.
Yeah, the pandemic fatigue, or what's the term, right? Like the great resignation, where people are just fed up of
Absolutely.
being at home, and there's this a lack of like, community building. Talk about like maybe the future of Alaycare a little bit. So you obviously, you guys has raised capital from well-established investors. I'm guessing you have growth plans. Maybe a very simple question is like, how big do you judge the opportunity? Like, how
Yeah.
early are we in Alayacare's growth potential?
Yeah, we are early. So, my ambitions with Alayacare are unending, right? I want there to be an Alayacare in 20 years, a strategic acquisition, and then you look back and 5 years later, where's that thing that you built, right? I lived that experience once. I'm not so motivated to live it again. This is the work of my life. And so I think, you look at the market we're in. So just in the markets we're in today, you've got over a $2 billion addressable market opportunity. We're at like a 70 million run rate, so plenty of growth. Just doing what we do in the market the way it's constructed today. But the more exciting opportunity is when you look at where home-based care can go, and then what technology can do to enable it. You put a 10x on the size of the opportunity. So today, our class of software commands somewhere around 1% of our customers' revenue. But when you actually look at what software does today and what it really can do, when the AI is really driving the plan of care, and when the marketplace is helping staff, and the optimizations doing most of the scheduling for the coordinators, you see that ultimately this is a $20 billion opportunity, and I don't think anybody is any better positioned than us to capitalize on that. So we think 4% of the resources put into home-based care delivery could accrue to technology if we're doing everything that we think we can be doing for our customers and for the market.
Yeah, I think it's the right mindset, right? Because I think technology tends to expand the TAM, just given the multitude of options, right? So if you look, the canonical example I gave is, like taxi cabs. It's like, oh, what's Uber's market share? Like, what's how many taxi cabs are there? But it's like, if you actually make it much more frictionless, well, then it increases the demand exponentially. I think you're in the situation where the demand's already there,
Yeah.
so it's really being able to get the market. What are the constraints then today? Because like you said, it costs so much more. It's like governments are like probably like at your door. Hey, we can see the benefit of being able to do this at home from a cost perspective. So are the constraints just connections? Like you said, developing integrations? Is it really more a question of go to market? So curious to hear you as to
Yeah.
like what.
Yeah. So there are two classes of constraints. Constraints on Alayacare being the software, Alayacare's market share, let's put it that way, and then constraints on the overall growth of the industry. As I mentioned at the outset, caregiver shortages have put a cap on the how quickly this market can grow. And the public health authorities and governments understand this. Reimbursement has to catch up, right? A personal support worker who can make more at Walmart than delivering care in the home, if that's the state of affairs, it's going to be hard to meet the labor demand. So you need some movement in reimbursement rates. It's also a matter of immigration policy and training, and it's quite a complex circumstance. So you have the constraints on the growth of the industry in general. For Alayacare, the thing about our category of software is that it's extremely sticky, right? Ripping out your practice management software and implementing something else is like open heart surgery. So in general, it's a 6 to 10 year replacement cycle for our class of software. And so what does that mean? Well, let's say we go into the Ohio Medicaid market, and we have hands down the best software in the market. You're still only going to see 10 to 15% of provider organizations in that state make a software decision every year. So there's a kind of a cap on how quickly you can grow based on that replacement cycle dynamic. And so how have we addressed that? It's one of the reasons we have added M&A to our growth playbook. Because typically, we've done a number of acquisitions, and typically we've acquired competing software where we have a good level of confidence that we can re-platform those customers onto our kind of modern tech stack and accelerate adoption in a given market that way. So those are the two biggest constraints. In terms of growing our business, like every other tech company in the world today, talent is really the scarce resource. So, those are probably the three main things I keep my eye on.
Yeah, fascinating. You guys obviously raised a big round last year. I imagine a large portion of that was earmarked for growth, for M&A, to be able to go out and acquire. How do you see the difference today in terms of your strategy on organic versus inorganic? Are you opportunistic on the M&A front, or are you more methodical and have work with, let's say, bankers, et cetera, to kind of plan it out?
Yeah. So we are methodical. We have a corp dev team. We've pretty much mapped the universe of potential acquisitions, and we have a regular cadence. Like we run it, like a sales funnel, right? So we are deliberate about it. What's interesting is, the capital markets have tightened substantially, right? Since the beginning of the year, there's been some multiple compression, certainly in the public markets. It's a little bit unclear how much of that or how or when that will trickle through to the private markets, because the quality assets are still commanding premium multiples. But how that shows up for us. So we've got a war chest full. And how do we deploy that capital? Well, do we think multiples are going to come down? And so might we rather buy, the same company 6 months from now versus now? It's a bit unclear. We'll see what happens with interest rates and all the other kind of macroeconomic variables. So that's one thing we're watching. What's the right time to do the acquisitions we want to do? But then the flip side is, if you were to really lean into organic growth, right? Continue to invest heavily in the product, be absolutely the best you can be across multiple markets simultaneously, and dominate the go-to-market arena. Maybe that's a more efficient use of capital. So it's really, these are very good problems to have. But I would say we feel pretty fortunate to have raised the round when we did. And we feel like the world is our oyster. So it's a question of how aggressively we go. And yeah.
Yeah, I was going to say great timing for sure, considering, like you said, I was going to poke you actually on capital markets and the effect it's had so far, but probably, there'll be more distressed assets for you guys to pick up. So that I think that's exciting on that front. On the talent side, maybe to poke you a bit, now you've built a 700 plus person organization. La question du jour is always about hybrid.
Yeah.
And building a robust culture, which before, when we're in person, obviously, it feels like a different epoch.
Yeah.
So how have you given some
Yeah.
thought about, okay, what's Alayacare 2.0, let's say, with the pandemic, how you manage building that same sense of belonging and same sense of mission when you have people that are distributed, decentralized?
Yeah. So we rolled out months ago what we call our Superflex program, and it's like it sounds. Do your focus work from wherever you want. We've got 7 offices around the world in Montreal, Toronto, Victoria, New York, Ohio, Columbus, Ohio, Sydney, Australia. We now have over 20 devs in Brazil distributed. So we want to leverage the asset of that global footprint. We kind of say, well, wouldn't you want to summer in Victoria and then spend your fall in Montreal and spend your winter in Sydney, right? So we're very happy for people to adventure while they work and lean into a nomad experience if they're in that phase of life. But we're early into many of our leases, so we haven't been able to shed a lot of real estate. And so we've pivoted into the physical space being event community space. Yes, some people like me like to come in every day or several days a week to do work, and that's great. But where we're trying to be really deliberate is around the planning and the community activities happening in person, and then supporting the focus work really wherever people want.
Yeah, as we're filming this, and it's like it seems to be beautiful downtown Montreal behind you.
Yeah,
So
I'm in the office, but when I look out, I see about 40 desks in my line of sight with 2 people in them. Uh, But whereas last week was our quarterly product and engineering planning, we had 100 people in the office, and then on Thursday we had to postpone our holiday party because of the last COVID wave. So we did everyone in the office for planning, and then a blowout party on the Thursday night. So I get a lot of energy out of those weeks, and I'm adjusting to not feeling bad about the empty offices I see out my window.
yeah, no, I could definitely relate to the late Christmas party. We had ours planned in December, and ended up being pushed. I think we did it like a few weeks ago as well. I want to go back to what you mentioned. I found it very touching about saying, you've gone down the path, you've built and sold to businesses, but didn't necessarily scratch the itch of building something that's more sustainable. Let's say. I was
Yeah.
thinking of the word in French. Um, what's your vision for Alayacare maybe long term? Is it going public, having access to obviously on the business front, having access like to capital on an easier basis, having a global footprint? So maybe if we zoom out, talk more long term.
Yeah. Yeah. So, like I said, I'm engineering back from I want there to be an Alayacare in 20 years. Okay. But I have investors with different horizons. I've, every employee here has stock options, or actually all RSUs now as well. And yeah, I want people to be able to turn that equity they help create into cash in their pocket, on at regular intervals. So yes, having a public company is one way to lock that in, but there are many downsides to being a public company. And if you look at especially the health tech companies who IPO'd at the peak of the last cycle, a year ago, they're all trading down. They're not loving life, regardless of how well their businesses have or haven't grown. So I've always had a fantastic experience with my investors, whether it's the earlier venture investors or the later kind of more private equity flavored minority growth investors. So I think the likeliest scenario is that we will recap the business every few years. Investors who want to get liquidity, get liquidity. Investors who want to, keep writing the story can keep writing the story. And we've always been very deliberate at giving people an opportunity to get liquidity on their equity, basically every year. And that's our intention going forward. We've always been in this fortunate situation where we're oversubscribed. We have more investors who want to invest in the business than we have, seats on the bus. And so, yeah, if we want to do an offering in the summer, and some subset of employees want to liquidate some shares to buy a house or whatever it is, great. That's fantastic. So that's really what I see. Probably a set of private minority investors and recaps on a kind of regular cadence as we grow.
Yeah, it's like that old Warren Buffett quote, right? It's like you only know who's swimming naked when the tide goes out. To your point of well-run businesses, like there won't be a shortage of capital for businesses that are well-run that are doing well. So I think in your case, it's definitely the point. Maybe a final question or two, Adrian, about we spoke about the state of technology today in home care. What is your vision for the future, right? Like in the sense of like the products that you're building, how software can have an even greater impact. Like you said, it's so early, so I imagine software is going to keep playing a much more important piece.
Yeah.
So imagine you guys have like wild ideas as to what's possible.
Yeah. Yeah. I'll talk about kind of three main vectors of innovation. Okay. Level one is around clinical outcomes. Okay. And we have a bunch of initiatives there. You can imagine there's a lot of patient insight that gets buried in narrative notes, right? The caregiver's in the home, Mrs. So-and-so's not feeling so well today, and, XYZ. And can a clinical supervisor consume all that? Not really. Some of the data, of course, you get in a structured fashion, but there's a lot buried in the narrative notes. So we have NLP models that will extract flag the notes that should be reviewed. We have risk models that do kind of triage which of my patients are likely to have an adverse event. And so there's a whole thread around clinical outcomes and then optimizing the interventions to get the clinical outcomes you're looking for. So that's one thread of innovation. Another thread is around resource utilization. Okay, so I talked about schedule and route optimization a little bit. Things like predicting employee churn. All these tools you can bring to bear on your resource pool, which is human capital in this space. So big thread of innovation there. And ultimately, if you were to crack open the P&L of a typical home care agency, you'll see kind of decent gross margins on the actual care delivery. And then you'll see about 30% get eaten in overhead. The coordinators calling the clients, calling the patients, doing the scheduling, following up with a physician. And, we think technology can cut that, in three if you do it right. So that's second thread of innovation. And then the third thread of innovation is more at the health system level, right? Rising above what the individual care providing organizations do and get up to the health system level. And that's where we have initiatives like Alayacare that allow our agencies running on Alayacare to share care workers, right? Because a Thursday afternoon in North York, I can't fill for this agency, might be exactly the slot a care worker at another agency needs to get to their, the 25 hours a week they need to pay their rent that month. So you got the Alayacare level, and then even up at the health authority level, being able to go in a predictable way or an optimized way from the assessment to the plan of care and kind of the authorization, right? So how much is the public health system willing to put forth for home-based care and of what flavors, right? Which is then typically usually delivered by the private sector, helping the public health authority place its resources optimally. That's kind of the third wave of innovation. So across clinical outcomes, resource utilization, and then health system optimization, that's really where we think we can have a very material impact on care of the future.
Yeah, and it's interesting. And it speaks to the fact before, like you said, 2 billion versus 10x from now, 20 billion in terms of adding all additional use cases, particularly because it creates a lot of value. And here you speak, it makes me think of like, well, when you decide to retire in 20 years and become a chairman emeritus, if you would consider becoming health minister, I think we could use you at the government level.
Yeah, I mean, in Quebec, right, we have a former executive from the case as our health minister, and our interactions with the CAC and with this government is very positive Because one thing that often is missing in the health center or health system is the mentality that actually, if you want efficiency in the future, you need capital investment now. And it's like obvious in every other sector, but because health is so human driven a sector, you don't always have that perspective. And yeah, it's actually been really interesting to see how our government now has progressed with this. There's like a business mentality, yes, also health and values, but yeah. So I'm not saying I'm going to go into politics, but I do think there are some benefits to having more of a kind of business perspective help government think through how they deliver care.
Yeah, 100%, 100%. Yeah, I think their latest plan was actually not too bad. So I have to say, like having that at least attempt something different rather than saying we're going to try the same thing we've done in the past. And Adrian, I could probably talk to you for hours. I find it's like you said, these kind of conversations give me energy where I just learn from companies that are really doing a positive change in the world. A final question for you would be: if people want to learn more, connect, reach out, what's the best way?
Yeah, you can, alayacare.com/careers. Let me merchandise that. We're always looking for great people. So check the company out there. But you can hit me up on LinkedIn, Adrian Schauer. There aren't that many showers out there. So Schauer. Be happy to chat with our listeners.
Adrian, thank you so much for your time.
Thank you.